of it is now going to be when we have it, diagnosis.
How we know somebody has pulmonary embolism?
Diagnosis. Yeah. So we can use but if you want to, what we do to check, we can do instrumental. We can assess the breathing rate, and then spirometry method. So we use this spirometry method to check the breathing rate.
Breathing rate.
We're going to this person is going to be forcing, you'll be using energy to breathe.
Too much breathing.
Using energy to breathe. This person will be using energy to breathe. And if in that case, the spirometer will be able to give us the product of because there is supposed to be around between 17 breath per minute. You understand that? 17 between 12 and 16. So if it is 17, it is increasing. You understand?
And what's normal rate,
between 12 and 16. Yeah,
it's a normal rate or breathing.
Yeah. So in a situation whereby you are having it faster, and then that is one. Another thing that this thing is going to do is going to give us the intensity of the breath. Intensity, how hard it is for this person. Like it is different for I'm breathing now, you are not even hearing I'm breathing. But now in the case of this person, it's going to be, we have inspiratory, we have expiratory. And so inspiratory is when it is breathing in, and expiratory when the person is breathing out. There is supposed to be, in inspiration is supposed to be normally shorter than expiration. But in the situation, it's supposed to be normally shorter than expiration, like this normal shot. Then if the person is breathing, it's supposed to be, but it's going to take longer time in both situations.
Both will take long.
Both of them are going to be long. And in this, we use a spirometer. This spirometer can tell us about this. And another thing that you are going to check this is instrumental diagnosis, where we use instrument to diagnose this person. Another thing that we can also do, laboratory tests, lab tests. This lab test, we can use it to check the cholesterol level in the person's blood. Cholesterol level in the person's blood. And also we can also do some assessment by what do we call it? General inspection. General inspection. So in general inspection, that one is going to be your inspection, where you are going to look at the rate at which the person is breathing. You are going to check the skin of the person. It becomes cyanotic, it becomes pale or something like blue. Why? Is because of reduced oxygen distribution in the body. And then you are going to check the eyes of this person. It's going to look like somebody that is very weak and tired. You understand? Because it's something that is acute. You understand? When it happens, it's something that is acute. Within short period of time, it can lead to death. You understand?
But why you don't write?
Of course, you are hearing, you are saying.
I know, but it will be more easier.
So now another thing there is that when we do in general inspection, you look at the person's chest, what shape is it assuming, and then another thing that they are going to do, we have inspection. Then we can also do palpation. We can do auscultation. It is in auscultation that you are going to see the difference between the intensity of the breath, how long it is inspiration, how long it is expiration. And then it is also in auscultation that you are going to be hearing if there is going to be any sound, any abnormal sound in breathing. You understand? Yeah. And so auscultation. Then you can also have percussion.
What do you hear in percussion?
No, percussion is for you to check the especially long border, especially during full in-breathing and full expiration. You understand? You ask this person to breathe in completely. You see, everything is going to be shallow actually. When somebody that is having this problem is because of the weakness or general weakness of the body, the person is not going to have the strength to take completely deep breaths to make this lung completely collapse. They will not be able to compress the lung, and if they want to breathe out, they will not be able to make the lung to inflate. So with us percussion, you'll be able to check the border of the lungs, the borders of the lung. And so it's these are the ways of diagnosing patients on emergency care and thromboembolism. And so then the symptoms that you are going to be coming across.
Sometimes why you like just keep. I brought one note like that. You just keep placing
symptoms.
Yeah.
So the primary symptoms of this person is going to be dyspnea. Dyspnea is what? Shortness of breath.
Yeah.
Okay. And then another thing that you are going to see is in symptoms is going to be cyanosis. Cyanosis due to oxygen deficiency. You understand?
Yeah.
Another thing is going to be general weakness. Another thing we are going to see is possibility of headache.
Why you get headache?
Dizziness because of decreased blood supply.
Increased blood supply?
Decreased
blood supply.
Because there is going to be possibility of development of hypotension, headache. Then I said you are going to see dizziness. Then what again can we see as a symptom? I've talked about dizziness is the primary thing that you should expect.
But Mansur, one more thing.
Yeah.
Here in pulmonary, here will be blood. Here will be blood. Artery.
No. Use.
Trachea.
You see, of course, why?
No, not this one. I mean, for artery. Okay. This one will be blocked. Why this blood doesn't go to the brain? You told about brain. It's told that because insufficiency, headache because enough blood doesn't go to the brain. Why?
Okay. See, if you remember this structure that we drew here. Blood is coming from the right atrium to the right ventricle, from the right ventricle to the pulmonary artery, from the pulmonary artery to the lungs, from the lungs, you understand?
Yeah.
To the pulmonary vein, from pulmonary vein to the left atrium, from left atrium to the left ventricle, from left ventricle to the aorta, from aorta to the carotid artery. You understand? From carotid artery to left and right carotid artery, from right and right carotid artery to the external and internal carotid artery. You understand? And then from internal carotid artery to the brain.
The brain.
It is like that, right?
It's like that.
Okay, let us now check. Now, blood is coming from the body from superior and inferior vena cava into the right atrium.
Yeah.
It's getting to the right atrium successively, right?
Yeah.
From right atrium, the atrioventricular valve opens and blood comes from the right atrium to the left and right ventricle.
Yeah.
Now, from right ventricle, blood is going to the pulmonary vein. Pulmonary artery, but pulmonary artery is blocked.
It's blocked.
How will this blood get into the lung? How will it come from the lung into the pulmonary vein? How will it come from pulmonary vein into the right and left atrium? How will it come from the left atrium to the left ventricle, then from left ventricle into the aorta, from aorta into the carotid artery? It cannot get to the carotid artery.
Some of it means that it calls for not only to all kidney, all other organs.
Of course, but it's just that the most important thing now that leads to all this problem. We said this person will die in 1 hour.
Yeah.
You remember, it is because everything is shut down. No blood supply to any organ.
But the most one he get earlier headache. This thing they had more.
You will quickly give this person oxygen if you know. Then they start to carry out the operation. You understand?
Yeah.
Then they do the operation to remove this emboli from the pulmonary artery.
Yeah.
This is the most important. The first thing that they do in this emergency therapy is provision of oxygen. So when oxygen is produced, when oxygen is provided for this patient, then they can easily take the person to the theater and then remove the emboli.
Yeah, but Master, I hear, for example, why here you talk about head earlier? Why you don't say that, for example, kidney failure? for example.
You're not serious. But we okay. If we say kidney failure, this is acute condition. Yours. How long will it take kidney to fail? Of course, even if before you talk about any acute incidents of kidney, you can talk about pyelonephritis, you can talk about nephrogenic disease. This can take, for anybody having kidney disease, can live for more than 1 month before he dies. If you want to die from kidney, of course you still, before somebody will die from kidney, the person can still live up to few days, one day. But we are talking about somebody dying in 1 hour. Then you are talking about kidney failure.
But
yeah, ask any question.
But no, sir, I understand, but I understand. So now you mean that, for example, I mean the blood, it earlier will go to the brain then before it's more faster to go.
What are you saying, Jones? See, even if anything is happening, I have told you, brain does not have any additional blood supply. You understand?
Yeah.
It is very close to the. You saw it by yourself. It is coming from the left ventricle. It goes into the aorta. From aorta to the carotid artery. Carotid artery supplies the brain. Now blood is not coming to the. Who is going to fill all this blood that is being blocked in the pulmonary artery? One, when it is blocked in the pulmonary artery, I want you to think very well. When it is blocked in the pulmonary artery, you understand me?
Yeah.
Now, pulmonary artery, the blood will remain in the right ventricle.
Yeah.
Because there is a lot of blood in the right ventricle, this blood in the right atrium will remain. Because of a lot of blood in the right atrium, blood in the inferior vena cava will remain.
Yeah.
Because of this blood in the inferior vena cava, blood in the thoracic aorta will remain. Blood in the thoracic aorta will remain, and then it means blood in the abdominal aorta will remain. Remember, kidney is taking its blood supply from the abdominal aorta. Imagine how much blood is remaining in this place. Even in 1 hour, in 2 hours, kidney is still having blood.
Yeah.
But now see, only from left ventricle to the aorta to the carotid artery to the brain. If blood is not there, where will brain get blood? If brain does not get oxygen in less than 30 seconds, this person will have this sinus. If it continues, there's going to be cerebral ischemia, and then in short period, cerebral ischemia cannot last for an hour. So you see why that is why the first therapy is oxygen therapy. First thing they do is to provide oxygen. It's not because of anything, but because of the brain.
Okay.
Do you understand?
Yeah, I understand.
So kidney can still suffer. Of course, we are talking about somebody dying in less than an hour. Kidney can still last for more than that.
Yeah.
You do a lot of things that will prevent blood supply. Of course, we talked about RAS system.
Yeah.
It is mechanism of the kidney to protect itself. What mechanism does brain have to provide oxygen for itself?
No. Only the artery.
So you understand this now?
Yeah.
It's like that. Okay, so we've talked about the symptoms, possible symptoms. We've talked about a way of diagnosis. Then we can talk about, and then we have talked indirectly, we have talked about the pathogenesis also. So now we can talk about possible treatment.
Yeah.
So and then we talk about oxygen therapy. Use of anti-thrombolytic drug. Why do we use this one? Thrombolytic.
To remove thromb.
Yeah, to lyse the thrombi.
Yeah.
Anti-thrombolytic drugs. Okay. So also we can anti-atherosclerotic drug. What anti-thrombolytic drug do you remember? Anti-thrombolytic drug.
Anti-thrombolytic drug.
Atherosclerotic drugs.
Heparin. No.
Yeah, you should. But if you want to talk about heparin and warfarin. Heparin, it is direct acting and anticoagulant. While warfarin, it is indirect acting anticoagulant. If your classmates say, "Use, please come," you just laugh. You just laugh.
I forgot, man.
Okay. So we talked about the impossible treatments now. Then what again can we talk about? And then we can also have, because we have emergency therapy. So the primary emergency care that we can provide for somebody that is in this kind of situation is oxygen therapy. You understand? And then we can also then be given some things like this, and then with time we can also supply the surgical treatment. You understand?
Yeah.
So you should not forget that the possible causes of somebody's thromboembolism could be due to could be due to increased cholesterol level.
Increased cholesterol. No. This risk factor.
Yeah, risk factors. And then we can have increased level of LDH, low density lipoprotein, then decreased level of HDH,
high density.
that is high density lipoprotein, high density LDH. Why did I say LDH? LDL, HDL, right?
Yeah.
Low density lipoprotein, high density lipoprotein. And then cigarette smoking. And
Most why smoking is
yes, of course, nicotine is present in cigarettes, you understand? And this nicotine has some small particles that easily get attached to the walls of blood vessels. And when it is, of course, if it gets into the wall of the blood vessels, normally every blood vessels has ability to secrete what we refer to as natriuretic hormone. All blood vessels, especially endothelium of all blood vessels, they produce natriuretic hormone. These hormones helps to protect the walls, or helps to protect something from attaching to the wall of blood vessels. If like this, this thing, they help to prevent attachment of any foreign bodies to the wall of blood vessels. But nicotine has ability to reduce the strength of this hormone. So nicotine can easily get attached. If nicotine attached to the wall of the blood vessels, it weakens it. Because of this, now it makes another thing also to attach to this wall, especially fats. You understand? When one thing is there, the body is going to want to produce hormones, substances that are going to help us to fight this foreign body in this region. So the body is going to release some lymphocytes, some macrophages, all those things that are used in the immune system. All of them will merge in this region, and then as they are merging in the region, you know that the amount of this thing will be increasing. You understand?
Yeah.
And as those things are increasing, this one's also is increasing. You understand?
Yeah.
So it will make it easy for this one to break. Once it breaks, then it gets into the blood, and from here it can travel to anywhere. It can travel into the coronary artery, it can travel into the pulmonary artery, it can travel to anywhere. It can travel to the pulmonary cerebral artery. If it goes to the cerebral artery, the person will have stroke. Somebody with stroke will not live also long before he dies. You understand? So it is these are the possible complications of thromboembolism. So we have talked about the risk factors, the smoking. We have talked about increased cholesterol level, increased LDL level, decreased HDL level. We have talked about possible diagnosis. We have talked about some possible symptoms. Then another complications that you can talk about.
Mansur, one more thing. You told that smoking has nicotinic. This nicotine can attach this substance, natriuretic.
Not attacking. This one is produced on the wall of blood vessels.
Yeah.
Nicotine is just going to attach the wall of the blood vessels and prevent production of natriuretic hormone. Natriuretic hormone is not going to be functioning as safe.
So it makes also other substance.
Yeah, to attach to this
wall. To attach this wall.
It gets complicated.
Yeah.
Complications. So complication, we can have cerebral. We can have stroke. We can have cerebral ischemia.
Monster, which stroke? Yeah.
Stroke.
Which brain stroke? What's the
coronary artery disease? What?
Which stroke the patient get?
Stroke. Stroke is when the blood vessels of the brain, something blocks the blood vessels to the brain. But you ask which stroke? Are there types?
I see that there's heart stroke, brain stroke. You don't have heart stroke?
Tell me, please. Let me learn from you.
Well, in Kurdish language, they say some people have
ischemia. Maybe they define it as ischemia. It is cerebral ischemia. Then we can ischemia. We can have coronary ischemic disease also. So maybe that is what they refer to.
So only on the brain.
You don't get me. You define it directly. What the stroke? What you call the stroke is ischemia.
Ischemia, yeah.
So this ischemia is almost like the same as stroke, but it is better if you call it ischemia than you call it stroke. If it develops in the brain, they refer to it as stroke.
Stroke.
There are actually different types of stroke, but in the brain. But if you want to talk about it being ischemia, it can happen to the cerebral artery. It can happen to the coronary artery.
Coronary artery.
Okay, so those are the there are still many other complications actually, but these are the most important ones. And we talk about the treatment. We talk about the surgical treatment can also happen. And we talk about symptoms. We talk about diagnosis. And then at this point we'll be calling it a day. And then tomorrow we'll continue. So you ask about a question.